COVID's still around. COVID is still in our hospitals. The commentary that the vaccine is not safe and that we don't have enough data on it is simply not true. Billions of people across the world have had this vaccine, and we do know the safety profile of it. And we certainly know that it has saved lives, and we know that things like myocarditis are quite a bit less with the vaccine than with getting COVID itself. There is no area in the world that says ivermectin should be used for COVID. And in fact, there have been studies, good studies done that show it's got no benefit. And we all know that drugs also, aside from having benefit, can have harm. The thought that we should just be able to prescribe whatever we want because we think it might work is not based in science. Many of us lived that pandemic in terms of looking after patients, watching loved ones suffer as people died in our hospitals. I know that there was economic pain with COVID and there was social isolation, but in one of our waves, we were very, very close, days away from sending people out of the province. It's certainly not a comprehensive review of the good scientific literature that's out there. There are parents out there, right, who don't necessarily have any medical training, who see that this report was paid for by the government, that it sits, within the government's purview to do something about, and that's very concerning for us. We should obviously have an expert in public health who would be on that task force. We should have experts in infectious disease and microbiology, other types of physicians. We should probably have patients, people who had COVID on that. We should have people who lost family members on that panel.